In a tumultuous week for science and health, several major stories have emerged that spotlight both the triumphs and challenges facing research and public health initiatives in the United States. From the resurgence of monarch butterflies in Mexico to alarming outbreaks of diseases like measles, the landscape is as dynamic as it is concerning, reflecting the intertwined fate of science funding and public health. One of the more uplifting developments comes from Mexico, where the wintering population of monarch butterflies has shown signs of recovery. Experts attribute this rebound to improved climatic conditions and increased humidity, which have fostered a more conducive environment for these iconic insects. The monarch's resurgence serves as a reminder of the delicate balance within ecosystems and the positive impacts of conservation efforts. Conversely, the public health landscape is marred by troubling outbreaks and funding cuts. A recent cholera outbreak in Sudan has claimed nearly 100 lives, highlighting the devastating effects of waterborne diseases in regions struggling with infrastructure and healthcare resources. Similarly, in the U.S., more than 200 cases of measles have been reported across Texas and New Mexico, primarily among unvaccinated individuals. This resurgence, marked by the tragic deaths of 2 individuals, underscores the critical need for vaccination and public health education. Amidst these health crises, researchers and healthcare professionals have rallied against funding cuts initiated by the Trump administration. Protests have erupted across the nation, with scientists voicing concerns that drastic reductions in federal support for health and climate research jeopardize not just the future of scientific inquiry but also the immediate health of the population. Charles Roberts, head of the Cancer Center at St. Jude Children's Research Hospital, lamented, "This will likely mean that fewer experimental treatments will get to children. More children will die." Such sentiments echo the broader fears within the scientific community as they face an unprecedented halt in new grant approvals and a significant reduction in funding. In the realm of space exploration, NASA has made the difficult decision to switch off instruments on the Voyager spacecraft to extend their lifespan. Launched in 1977, Voyager 1 and Voyager 2 have traveled beyond the solar system, gathering invaluable data on cosmic phenomena. With power supplies dwindling, engineers are deactivating certain scientific instruments to prolong the mission, a testament to the innovative spirit that has characterized the Voyager program for nearly 5 decades. As NASA project scientists emphasize, every day could be our last. Underscoring the urgency and importance of maintaining these pioneering spacecraft as they continue their journey into the unknown. The precarious state of funding for scientific research has also sparked discussions about its economic implications. Melanie Mitchell, a professor at the Santa Fe Institute, articulated a profound concern, stating that federal science funding, which has historically driven innovation and improved public health, is now under severe threat. She highlighted the essential role that scientific progress plays in national security, economic growth, and overall well-being, warning that cuts could stifle the next generation of discoveries. As we navigate these challenges, it becomes clear that science and health are at a crucial crossroads. The interplay between funding public health and environmental conservation will shape not only the future of scientific inquiry but also the health of our communities. With a pressing need for advocacy and support for research, the coming months are likely to be pivotal. The outcomes of ongoing protests, policy decisions, and scientific endeavors will determine the trajectory of health and science in America, potentially impacting generations to come. As we look ahead, the hope is that the collective voices of researchers and advocates will resonate, ensuring that science remains a priority in shaping a healthier, more informed society. In recent months, the landscape of American science has faced unprecedented challenges, particularly under the leadership of former President Donald Trump, who has returned to office with a controversial agenda that threatens the stability and progress of scientific research. As the nation grapples with the implications of this shift, experts warn that the consequences could be dire, not only for current scientific endeavors but also for future health innovations. The United States has long been a beacon of scientific advancement. Thanks to significant investments in federal research that have led to breakthroughs in medicine, technology, and public health. Historical figures like Vannevar Bush, who spearheaded initiatives during World War II, laid the groundwork for what would become a robust system of federally funded scientific inquiry. The National Institutes of Health (NIH), for example, has evolved into the world's largest funder of biomedical research with a budget of $48 billion, supporting thousands of scientists and resulting in impactful developments such as mRNA vaccines that have been pivotal in combating the COVID-19 pandemic. However, under Trump's recent administration, this long-standing commitment to government-funded research appears to be in jeopardy. Since taking office again, Trump has implemented policies that drastically alter the funding landscape for scientific research. Reports indicate that communications from health agencies have been curtailed, data has been removed from public access, and there have been significant layoffs among government scientists. The proposed budget cuts to the National Science Foundation could slash its funding by two-thirds, a move that would severely limit the scope of future research initiatives. Moreover, the NIH has effectively halted the awarding of new grants, releasing approximately $1 billion less than the previous year during the same timeframe. This funding freeze has drawn alarm from the scientific community, with experts like Charles Roberts, head of the Cancer Center at St. Jude Children's Research Hospital, asserting that such measures will have dire consequences for pediatric patients. More children will die, he warned, highlighting the real-world implications of these budgetary decisions. The ramifications of these actions extend beyond immediate funding concerns. They risk unraveling decades of progress in medical research. As America's leadership in scientific output wanes, countries like China are surging ahead, now surpassing the U.S. in the production of highly cited papers and patent applications. The geopolitical implications of these shifts are significant, with experts predicting that continued reductions in federal support for science could leave the U.S. lagging behind. In a broader context, the narrative surrounding public health has also shifted dramatically since the COVID-19 pandemic. 5 years after its onset, skepticism towards scientific guidance has permeated public discourse, fueled by a rise in populist rhetoric. As Laura Spinney notes, trust in vaccine efficacy and public health measures has declined, with a new narrative emerging that blames the governmental response for the disruptions caused by the pandemic rather than the virus itself. This ideological shift poses a substantial risk to future pandemic preparedness and public health initiatives. As the nation wrestles with these challenges, the urgent need for a cohesive strategy to bolster scientific inquiry and public health is more critical than ever. The recent approval of a new vaccine for older adults utilizing mRNA technology similar to that of COVID-19 vaccines underscores the potential for innovation amid adversity. However, without robust support and a commitment to scientific integrity, the path forward remains fraught with uncertainty. In conclusion, the landscape of American science is at a crossroads. The actions of the Trump administration have not only threatened the funding and integrity of scientific research but have also jeopardized the public's trust in science itself. As we look to the future, it is imperative that a renewed commitment to scientific inquiry and public health is fostered, ensuring that the lessons learned from the pandemic lead to a more resilient and informed society. The stakes are high, and the time for action is now. A recent research presented at the American Heart Association's Epidemiology and Prevention, Lifestyle and Cardiometabolic Health Scientific Sessions 2025 highlights the significant impact of physical activity on the cardiovascular health of postmenopausal women with a history of cancer. The findings suggest that increased physical activity, particularly walking, can markedly lower the risk of death from cardiovascular disease among this vulnerable population. The study, which followed nearly 2,500 women aged between 63 and 99 for approximately 8 years, underscores the importance of physical activity as a means to improve health outcomes for cancer survivors. Lead author Eric Hyde, Ph.D., MPH from the University of California, San Diego, noted encouraging cancer survivors to be more active, sit less, and take more steps every day could be a feasible approach for prolonging survivorship and reducing the risk of cardiovascular disease mortality. The data revealed that engaging in 1 hour of moderate to vigorous physical activity daily could reduce the risk of death from any cause by an impressive 40% and cardiovascular disease mortality by 60%. Each additional 2,500 steps taken daily was correlated with a 34% decrease in cardiovascular death risk. This study builds upon previous findings that have shown cancer survivors are at a heightened risk for cardiovascular issues, reinforcing the American Heart Association's position on the critical role of exercise in recovery and rehabilitation. The research was conducted using accelerometers to track participants' daily physical activity, categorizing it into light, moderate, and vigorous intensities. The analysis revealed that even moderate amounts of physical activity, less than the often cited 10,000 steps a day, were beneficial. Risk reductions were even evident when participants walked fewer than 5,000 steps per day, Hyde explained, highlighting the accessibility of walking as a form of exercise that can be easily integrated into daily life. Keith Diaz, Ph.D., a certified exercise physiologist and member of the AHA's Physical Activity Science Committee, emphasized the findings' implications for cancer survivors. While structured exercise remains the most efficient and effective way to improve your health, these findings highlight that walking, at any intensity, matters. The road to an active lifestyle is more accessible than we often assume. He also pointed out the concerning trend of increased sedentary time, which poses additional health risks, particularly for those recovering from cancer. The study's results are preliminary, as the findings presented at the conference have not yet undergone the rigorous peer review process. However, they contribute to a growing body of evidence supporting the implementation of physical activity programs tailored for cancer survivors, aiming to enhance their quality of life and longevity. As the healthcare community continues to grapple with the long-term implications of cancer treatments, especially their cardiovascular toll, the findings from this study present a hopeful avenue for improving survivorship. The researchers advocate for further studies that assess physical activity patterns across various stages of cancer treatment and recovery, which could lead to more personalized and effective rehabilitation strategies. In conclusion, the evidence that increased physical activity can significantly reduce cardiovascular death risk in cancer survivors is a powerful reminder of the importance of exercise in health maintenance. As awareness grows, it is likely that more healthcare providers will prioritize physical activity as a key component of post-cancer care, ultimately fostering longer, healthier lives for survivors. The ongoing dialogue at scientific conferences like the AHA's will be crucial in shaping future research and public health strategies aimed at enhancing the well-being of this critical demographic. In a groundbreaking advancement for quantum communication, scientists have leveraged artificial intelligence to simplify the process of achieving quantum entanglement, a phenomenon famously described by Albert Einstein as spooky action at a distance. This breakthrough, reported in a recent study published in Physical Review Letters, not only sheds light on the complexities of quantum physics but also brings the prospect of a quantum internet closer to reality. Quantum entanglement allows particles such as photons to share properties and information instantaneously, regardless of the distance separating them. This feature is pivotal for the development of quantum computers and secure communication systems. However, forming these entangled pairs has traditionally posed significant challenges for researchers, primarily due to the intricate setups required for entanglement swapping processes. The established method necessitates preparing two separate pairs of entangled photons and measuring their entanglement strength, a procedure that often leads to the collapse of the quantum system before the desired entangled state can be achieved. The innovative study employed an AI tool named Pythia, specifically designed for crafting quantum optic experiments. Initially, the researchers aimed to replicate existing protocols for entanglement swapping, but were taken aback when the AI consistently suggested a far simpler method. According to Sofia Vallacorsa, a research physicist at CERN, the AI tool proposed that entanglement could emerge when the paths of photons were indistinguishable, leading to the creation of entangled states without direct interaction. Skepticism initially surrounded the AI's results, but the researchers decided to test the theory. They manipulated the photon sources to ensure their indistinguishability. ultimately leading to a successful demonstration where detecting certain photons guaranteed the emergence of entangled counterparts. This simplification could have significant implications for quantum communication technologies, particularly in the realm of secure messaging systems. The more we can rely on simple technology, the more we can increase the range of applications, Vallacorsa noted, emphasizing the potential for creating more complex quantum networks. Despite the promise of this AI-assisted approach, practical scalability into commercially viable processes remains uncertain. Environmental noise and device imperfections could introduce instability into quantum systems, necessitating further research and development. Nonetheless, the study underscores the potential of AI as a transformative tool in physics research, a sentiment echoed by Vallacorsa, who highlighted the mixed feelings within the physics community regarding AI's role in scientific inquiry. The integration of AI could lead to more efficient experimentation and novel discoveries. But it also raises questions about the future of physicists' roles in research. Overall, this advancement not only marks a significant step forward in quantum physics but also showcases the potential of AI to revolutionize complex scientific processes. As researchers continue to explore the implications of this discovery, the horizon of quantum communication appears increasingly accessible, hinting at a future where secure instantaneous information transfer could become routine. The journey toward a fully realized quantum internet is gaining momentum, with AI playing a pivotal role in overcoming the obstacles that have long impeded progress in this field. In a significant leap towards harnessing the power of nuclear fusion, China has announced that a critical component of its next-generation artificial sun has successfully passed expert review. The 1/8 vacuum chamber and overall installation system is a pivotal subsystem of the comprehensive research facility for fusion technology craft, marking a milestone in the nation's ambitious initiative to replicate the energy generation processes of the sun. This development underscores China's growing capabilities in advanced energy technologies and positions the country at the forefront of global fusion research. Developed by the Institute of Plasma Physics under the Chinese Academy of Sciences, the 1/8 vacuum chamber resembles a slice of orange featuring a D-shaped cross-section. The structure stands 20 meters tall and is crafted from ultra-low-carbon stainless steel, weighing in at an impressive 295 tons. This chamber is designed to withstand the extreme conditions of a fusion reactor, where temperatures can soar above 100 million degrees Celsius. As Liu Jihong, the lead scientist on the project, explained, the vacuum chamber serves as the first line of nuclear safety protection, necessitating precise welding and structural integrity. The successful completion of this vacuum chamber indicates that Chinese researchers have mastered the critical technologies required for constructing a complete toroidal vacuum chamber for future fusion reactors. Over the past decade, the research team has navigated numerous technical challenges, securing more than 40 patents along the way. Liu highlighted that the technology developed for this system could also be applied in other fields such as particle accelerators and precision machinery. The implications of this advancement extend beyond just energy generation. The craft facility aims to create a platform for the installation, inspection, and operational research of components within future fusion reactors, thereby accelerating the development of sustainable energy sources. As China continues to push the boundaries of fusion technology, it is also witnessing unprecedented success with its experimental advanced superconducting tokamak East, which has been setting world records for sustained plasma confinement. This focus on fusion energy aligns with China's broader strategy to lead in disruptive technologies, as emphasized by President Xi Jinping's call for innovation and self-reliance in scientific development. The nation's commitment to advancing technologies like artificial intelligence, quantum computing, and next-generation energy solutions reflects its aim to reshape global energy landscapes and mitigate climate change challenges. Furthermore, in another area of scientific inquiry, researchers are exploring the use of neutrinos, nearly massless particles produced during nuclear fusion, as a means to gain insights into the sun's core activities. This innovative approach may enhance our understanding of solar dynamics and improve predictions of solar activity's impact on Earth. Similar to China's advancements in fusion technology, These developments signify a burgeoning interest in leveraging cutting-edge science to unlock the mysteries of our universe. As China forges ahead with its ambitious fusion energy projects and scientific research, the implications could be profound not only for its energy landscape but for global efforts to achieve sustainable and clean energy sources. With the successful review of the 1/8 vacuum chamber, the nation moves closer to realizing its vision of a powerful and eco-friendly energy future while also setting a precedent for international collaboration in fusion research. The coming years promise to be critical as these technologies evolve and their applications expand, potentially transforming the way the world generates and utilizes energy. A significant breakthrough for the field of superconductivity. Researchers from Queen Mary University of London have proposed that room temperature superconductors may not only be theoretically possible but could also exist within a hidden upper temperature limit defined by the fundamental constants of nature. This revelation could pave the way for transformative applications in sectors such as energy transmission, quantum computing, and healthcare. Superconductors, materials that can conduct electricity without resistance, have historically required extremely low temperatures, often near absolute zero, to function. This limitation has hindered their widespread application, prompting scientists to explore the potential for room temperature superconductivity. A critical question arises: is there a theoretical upper limit to superconductivity that lies below room temperature? If so, achieving such a state would be fundamentally impossible. The recent study sheds light on the intricate relationship between superconductivity and fundamental physical constants, including electron mass, Planck's constant, electron charge, and the fine structure constant. These constants govern the interactions and vibrations of atoms within materials, influencing how they behave under thermal energy. As the researchers explained, the speed of atomic vibrations determined by bond strength and atomic mass sets a limit on the frequency of phonons, collective atomic vibrations essential for electron pairing in superconductors. By analyzing these constants, the team found that the maximum temperature Tc at which superconductivity can occur is intrinsically linked to the constraints imposed by these fundamental constants. Specifically, they concluded that superconductivity could theoretically exist in a temperature range of 100 Kelvin to 1000 Kelvin, encompassing standard room temperature values between 293 K to 298 K, 20 to 25 degrees Celsius. The fact that room temperature superconductivity is theoretically possible given our universe's constants is encouraging, the researchers stated, calling for continued exploration and experimentation in this field. This study not only deepens our understanding of superconductivity but also highlights the potential for future advancements in technology. If room temperature superconductors can be realized, the implications for energy efficiency and technological advancement could be profound. As the researchers noted, this finding serves as a catalyst for further investigation into the materials and methods that might bring this theoretical possibility into reality. Looking ahead, the scientific community is poised to pursue further studies that could unlock the mysteries of superconductivity. The potential for discovery in this area underscores the importance of continued investment in fundamental research, as the path to practical applications may depend on overcoming significant scientific and engineering challenges. As the quest for room temperature superconductivity continues, it stands as a testament to the enduring pursuit of knowledge that drives innovation in science and technology, potentially reshaping our understanding of materials and their applications in the future.